Recognize Ms. Lesko from Arizona for 5 minutes of questions.
Thank you. Dr. Welensky, in an April 26 hearing with American Federation of Teachers Randy Weingarten, we learned that she has your direct phone number. This is particularly interesting because of some of the nearly verbatim language and additions to the CDC's school guidance that you took from the American Federation of Teachers. Dr. Welensky, do you maintain an official government and personal cell phone?
I do, but may I also comment that
I have several questions. Does Ms. Weingartner have your official or personal cell phone numbers, or both?
I believe she has both.
Have you ever exchanged text messages with Ms. Weingartner?
I have.
Were these texts on your official or personal phones? Or both?
I would have to go back and check. It may be both. I would also say that I recognize that as part of the record retention requirements.
I have several questions.
Yeah.
I'm sorry. Then if we have time, we can expand. Were these texts in furtherance of official business or about the business of the CDC?
I imagine I would have to go back and look.
The Select Subcommittee is in possession of about 5 text messages between yourself and Ms. Weingartner. Are there more?
You know, there are hundreds of FOIA requests, so I am not privy to all of the details of all of the ones that you have. But I will say that regardless, I recognize
have you ever deleted any text messages to or from Ms. Weingarten?
I am aware of the requirements for retention of these records, and I am compliant.
Have you ever deleted any?
No.
Thank you.
As part of the records retention.
My next question, you had said earlier that the CDC's goal is to get out the most accurate information and the most timely, most recent data, or something to that effect. I just looked at the CDC's website. It's titled, "Use Masks to Slow the Spread of COVID-19." It specifically says, masking is a critical public health tool, and it is important to remember that any mask is better than no mask. Wear the most protective mask and you can that fits well and that you will wear consistently. Wearing a high-quality mask along with vaccination, self-testing, and physical distancing helps protect you and others by reducing the chance of spreading COVID-19. Dr. Welensky, why aren't you and your staff wearing masks?
Because we also have guidance on our website that says that mask wearing can be related to our hospitalization levels, our local hospitalization levels, and right now over 99% of counties, thankfully,
but Dr. Welensky, that doesn't say that
levels.
on your own masking website on the CDC.
Well, there's a link from our hospitalization levels to say when you should think about wearing masks. We also have in there that people can and should wear a mask whenever it is that they please. There are people in this room wearing masks, and it gives guidance to the people in this room.
But your own website, you had said you give out the most recent information, data. Your own website has this that says you should wear a mask in addition to vaccination, yet you and your staff are not wearing masks. I don't understand.
Our website has context in it, right? Of course, there's a link to our community hospitalization levels, and those hospitalization levels give recommendations on where to mask.
But that's not on this simple page that the public sees. So may I suggest that you update your own CDC website about masks? Thank you, and I yield back.